Hello everybody, this is Dr. Robert Elvire coming again with another segment of 357 Medicine. Something that's been coming up to me this week at work and at the clinic is diabetic complications like diabetic neuropathy and other complications of that sort. So today we're going to talk about diabetic neuropathy and diabetes in general. Real quick, diabetes is a dysfunction between the pancreas making insulin and or your cells receiving sugar and or the insulin. There are two types. Type 1 you're born with. Type 2, which is the majority of people, is actually a malfunction of your lifestyle and diet. So the three categories and diabetic criteria are polyuria, polyphagia, and polydipsia. Polyuria, increased urination. Polyphagia, increased appetite. And polydipsia, increased thirst. And these are all ways that your body is not properly processing food, sugar, or getting sugar into the cell. So polyuria, you have too much sugar, your body tries to urinate it out. Polyphagia, you can't get sugar in, so you trying to get food in to the cell some way, somehow. And polydipsia, polythirst, it's your body trying to flush out or dilute sugar. So that's the Western side. Some typical peripheral neuropathy issues are loss of feeling, they feel like they're freezing. Something I hear is, it's like ants skating on me, or ice picks. Less dramatic, tingly, or very hypersensitive. And kind of branches out from there. Some people actually get burning. That's peripheral neuropathy. Typical complications of diabetes and diabetes mellitus is eye damage. Your actual kidneys have issues processing sugars and improper circulation to the kidneys. Diabetic foot, which we kind of covered already. Improper balances and metabolism of sugar in the brain, so cerebrovascular diseases. Same thing would happen to your heart if your heart can't get enough sugar to pump itself, and then obviously the nerves. Now, on the Chinese medicine side, it's broken up into three categories, but the overall term is called Xiao Ke. We're not going to go there too far. It just goes into the upper, middle, and the lower segments of your torso. The upper body is the lung dryness. So what does that mean? So if you have this kind of diabetes, Xiao Ke, you have dry brittle nails, dry skin, things of that sort. And then in the middle, I call it the stomach heat problems. It's like you're always eating, trying to get food in, cook it properly, and then get those nutrients into the body, into the cells. And in the lower jaw, your kidney indeficiencies, improper processing of sugar, improper circulation to the kidneys, where the kidneys don't have enough energy to get the nutrients separated at that level. Now, combining east and west, diabetic neuropathy is just poor circulation to the nerves, and the body does a version of shunting. So when you have decreased circulation peripherally, especially the feet, the nerves can't feel. They're kind of like sending screaming messages, hey, I'm not getting enough blood, oxygen. Eventually, if it's not treated correctly, you don't feel nothing, which is not a good sign. A lot of people think that's a good sign. It's actually a bad sign if you've been actually dealing with diabetes and diabetic neuropathy. And if you start getting it treated properly, the return of pain is actually a good sign, until it gets so good where you're not feeling pain. So that's a quick overview of diabetes mellitus from the east and west side. Now, how would you treat it? First, diet, lifestyle. Change your diet. What's making you have unstable sugar? Down, dirty, simple. Too many simple sugars in your body, pancreas can't handle it. That's the most basic form. So we got to change your diet. I would treat it with modifying your actual diet and lifestyle. Then we go to the actual acupuncture after we start stabilizing your pancreas and telling the body where to go with the needles and the acupuncture. It's like, hey, heal this, work here, and connecting all the channels to heal the whole body as well as the pancreas and your digestion. And then that will be the basis of it. It will be a lot more in detail. If you come see me, there'll be a 3-part process. The 3rd part I would explain at the clinic. I hope this helps, and hope to see you soon. And if you are living with diabetes or further complications, diabetic neuropathy or other things that I spoke about, please go get it taken care of with your medical doctor, or with me or another type of physician that understands what's going on with your body. Take care, long life, cheers, and cosecha.